When early developmental trauma is left unresolved, it severely deforms the adult personality over time. It surfaces as an intense need for absolute control. The individual constructs a rigid, coercive environment simply to hold their own internal panic and chaos at bay. Often this involves severe substance misuse. Chronic alcohol and cannabis addictions act as a maladaptive strategy to self-medicate that internal trauma. But the pharmacological reality of chronic use actually destroys executive function and actively erodes impulse control. When a critical boundary or safety violation is exposed, like a partner's sexual misconduct, that fragile control is threatened. Anyone trying to protect a child in that environment is immediately categorized as an existential enemy. Curious, analytical tone. If a primary abuser doesn't have direct physical access to a target, how do they enforce geographic isolation and strict rules? They build a network. The abuser pivots to a multi-agent system, assembling a coordinated family subsystem that acts entirely on their behalf. This network graph maps a specific family dynamic. We have a primary abuser, the mother, along with her proxies, a boyfriend and maternal grandmother. They, alongside a vulnerable co-parent, surround the central node, the 10-year-old child. In clinical and forensic literature, this structure is defined as coercive control by proxy. The network forms an impenetrable boundary, effectively executing a domestic gag order. To dismantle that order, professionals must forensically map exactly how psychological control flows through these proxy nodes. Looking closely at the primary node, the mother's volatile instability is driven by severe addictions, used continually as self-medication. The prolonged pharmacological effects degrade her executive functioning and escalate physical and verbal aggression toward the rest of the network. The system reaches a crisis point when a critical boundary violation is exposed to the outside. For instance, the boyfriend committing sexual misconduct or driving under the influence with the child in the vehicle. Her response to this exposure is highly defensive. She relies on aggressive denial, psychological projection, and a staunch alignment with the perpetrator. She is not acting to protect the child. She is aggressively defending the dysfunction of her environment against any outside scrutiny. To secure the perimeter, she forms a unified proxy cluster, formally pulling the maternal grandmother and the boyfriend into the enforcement group. This cluster executes systemic surveillance. Every interaction the child has is closely monitored by multiple agents. The specific purpose of this micro-regulation is to detect any leaks regarding the active safety violations in the household, such as the boyfriend's behavior or the mother's substance use. The group also deploys coordinated campaigns of denigration. This involves continuous, multi-generational bad-mouthing of the child's protective figures, specifically the father and the grandfather. For a 10-year-old, the psychological impact induces deep loyalty conflicts and systematically disrupts her secure attachments to stable caregivers. These tactics constitute a severe form of emotional abuse. They psychologically pressure the child into aligning with her abusers simply as a necessary survival mechanism. But the most critical dynamic in this family system involves the exploitation of the child's father. The father's baseline state makes him uniquely susceptible. He struggles with chronic alcoholism and presents a severely passive, avoidant personality. Clinically, this chronic alcohol abuse results in significant cognitive deficits, often referred to as a booze brain mindset, along with heightened anxiety and a total loss of personal agency. The primary abuser actively targets this exact lack of emotional resilience and cognitive clarity. Because he cannot withstand her continuous verbal onslaughts, the father is primed to be completely dominated and ultimately weaponized against the child. To control his gatekeeping, the mother utilizes a strict conditioning system based on intermittent punishment and reinforcement. First, the punishment phase. If the father facilitates a visit between the child and a protective figure, like the grandfather, the mother immediately subjects him to severe verbal abuse or threatens his custody time. Then, the reinforcement phase. If he complies with the isolation and denies the child access, he is rewarded with a temporary reprieve from her harassment. This reprieve creates a powerful hostage dynamic. The father learns that his only protection from her rage is complete compliance. As a direct result of this trauma-based conditioning, he abandons his role as an independent protective parent out of sheer self-preservation. He has been co-opted into the role of the isolation manager. He actively polices the grandchild, monitors her interactions, and blocks outside visits on the mother's behalf. Through this exact mechanism, the primary abuser enforces a total geographical gag order without ever needing to physically step in and block the child herself. Translating these hidden structures into legal action requires looking closely at jurisdictional frameworks, specifically the child protection laws of British Columbia. This replicates the structured decision-making safety tool, the required mandate for child protection reports. First, we map caregiver impairment from substance abuse and failure to protect against a sexual perpetrator. Next, we map physical endangerment from driving intoxicated and co-opted isolation blocking protective relatives. Under the SDM protocols, this specific combination of harms moves well beyond standard family dysfunction. It firmly categorizes the dynamic as a high-risk safety profile that demands immediate statutory intervention. The first operational step is filing a Section 14 safety report. This cannot focus solely on the primary abuser. It must explicitly detail the father's alcoholic cognitive decline and his fear-based co-optation. Because both parents are incapacitated by addiction and fear, there are strong grounds to apply for a Section 51 urgent guardianship order. To prove this in court, a Section 211 forensic parenting assessment should be requested, bringing in a clinician to map the coercive control and proxy abuse mechanics. Returning to our graph, these legal tools act as intervention lines, severing the coercive links binding the child to the proxy network. Furthermore, federal legislation like Bill C-92 draws a protective link, bypassing the abusers entirely to place the child directly with her grandfather. By accurately mapping the pathology of the isolation manager, practitioners can weaponize the law to shatter the proxy network, bypass the co-opted gatekeepers, and secure the child's safety and cultural identity.